Let's talk about how injection abscess is formed. Have you ever noticed a dimple on your buttocks and then you were told that it was when you were little you were given an injection? Or are you planning to go take an injection? You're having malaria, you're having typhoid, or you're not feeling well at all. Be very careful. Watch this video, share it, and subscribe to my YouTube channel to have more of these updates. Now, let's talk about what injection abscess is. This is a swelling around the buttocks of a human being, okay, of an individual that is filled with pus. So you see it swell like a boil, and the area becomes reddened and hard, and then it is filled with pus. This person is in a lot of pain, and until that pus is drained out, the person will not get him or herself. Okay? So while you're watching this video now, I want you to pause. Go and stand before a mirror. Take a look at your butts. Have a look. Do you have anything called dimple? That is like a part of your buttocks that recedes in, that curves in, just a localized area. This might be as a result of an injection abscess that you had probably when you were still growing up, or as a child, or even as an adult. It is due to administering an injection into the wrong tissue, into the wrong site. The common cause is going to quacks, who then administers an injection into the wrong tissue in your buttocks. Number 2, using an unsterilized needle to administer an injection into the muscle, into your buttocks. Ideally, an injection or a syringe and a needle is supposed to be for single use only. That means just once and it's thrown away. But for economic purposes, so many quacks use one needle, wash it, and reuse again. That is a wrong practice. That can introduce bacteria into the body through that needle. Number 3, not properly cleaning the skin. That's the area where this injection is about to be administered. So ideally, you use methylated spirit to clean that area to ensure that it is, it has a little bit of sterilization before you introduce something, because you're piercing the skin, and if you don't clean that area, there's a possibility that germs, bacteria can actually penetrate, because that is you opening somebody's skin using a needle. But I'm here to dwell on the most common cause, which is the wrong site administration. Now, let's assume the whole of this is the buttocks of a person, okay? Now, we know that there is a division. Okay, we know there is a division here. You can see this line that divides the both buttocks. Okay, this division here is called the cleft. That is, divides one buttocks and the other. Okay, let's assume this is the left buttocks and this is the right buttocks. If you want to administer an injection, I'm just explaining this because you as a person, you deserve to know how an injection should be administered, so that when you go to a chemist, you go to anywhere and somebody wants to inject you, you should be able to, if you sense that, you should be able to sense that, this is not the right spot. Ma, please, I was told, or I've read, or I heard that injection is normally administered in so area and not so area. That's why this teaching is coming today. So this is the buttocks. Let's assume we want to give the injection on this side of the buttocks. Now, what the person is supposed to do is to divide the buttocks into 4. So 1, 2, just draw a cross there. Draw a cross there, and then the injection is supposed to be given here. This side where I've made this mark is called the upper outer quadrant. All right, the upper outer quadrant of the buttocks. This mark I've made here, that is where the injection is supposed to be given. Reason being that along this inner part here, there is a nerve called sciatic nerve. Now that nerve helps to coordinate mobility or movement or balance of a person. If an injection is not given in this outer part and you see the person coming towards the inner part, that is near where the line that divides your two buttocks is, please run away. Please tell the person no, okay? Because you might end up damaging the sciatic nerve. So that is another topic on its own. Today I'm dwelling on abscess. So supposing the person injects, if the person brings an injection and gives it anywhere around here, what might happen is that there is so much fatty tissue around here that if the person injects it, if the person injects it here, that is injecting into the wrong tissue, okay? And by so doing, there's going to be, bacteria build up there. Because the body now will be trying to, when it injects into that wrong tissue, there's going to be bacterial formation, which will now lead to the body's immune system trying to fight this bacteria by releasing some white blood cell to that area. Now, when the white blood cell gets there and tries to fight and kill the bacteria, so the combination of this white blood cell that went to fight, the bacteria that it will definitely kill, the tissue where this injection was put in that has become damaged, combined together would lead to what is called pus formation. There will be pus now that will gather in that area, and then the area will become swollen. It will become reddish, tender to touch. Very painful, because when a place is swollen or inflamed, the next thing is pain. That is caused by the infection that happened, okay, causing the tissue around that area to become dead. The white blood cell the body released to go and fight the infection, and the bacteria that the white blood cell eventually killed joined together. That's what causes pus formation that leads to what is called abscess, injection abscess. This should be avoided. When you go to get an injection, you don't need to be a medical personnel, but just know this, that on the buttocks is supposed to be given on the upper side and the outer side. Okay, so the upper outer quadrant of your buttocks, which is away from the middle line that divides your two buttocks into two. Do you understand that? So please avoid injection abscess today. Now, talking about, have you ever seen a person limping or unable to walk or paralyzed on one limb, on one leg, and then you were told that it was when after you had an injection when you were a child that happened? Okay, now that is as a result of damage of the sciatic nerve. I explained something about sciatic nerve before. Okay, so this side is the other buttocks. Like I said earlier, this is the middle part that divides the two buttocks into two. Now, injection is supposed to be given on this outer side. Okay, because there is a nerve that passes through this middle part that is called sciatic nerve, and if for any reason an injection is given here and it damages that nerve, that person might be paralyzed for life or begin to limp. Yes, please avoid giving injection towards the inner part of the buttocks, that is nearer to the line that divides the both buttocks. Now, that is why if you see a nurse or a health personnel giving an injection, the first thing that they do is after inserting the needle, they aspirate. Okay, so they draw it out a little to see if there is any blood that will come inside the syringe. Now, if they see any flash of blood at all, it means they are in the wrong place. They have mistakenly punctured the sciatic nerve. Okay, so they will definitely pull out the needle and go to another site. It is a common mistake that can happen. Inserting a needle, and when you aspirate and you see blood, it can happen. You immediately take it out and go to another site to inject. That is why you should avoid coming closer to the inner aspect of the buttocks. But a lot of people just stab the needle in, they don't aspirate, they just go in because they assume that they are experts. There's no expertise in this. Make sure you always aspirate your needles to see if there's any flash of blood that will come in. And if there is, please remove it and check for another site. Okay, we know that common mistakes happen, but we should learn every day to avoid all this, because the life of the people we are treating is somehow in our hands at that particular moment. Be wary, be aware. Do not avoid injection abscess today. Avoid being paralyzed by taking an injection. Know who gives you an injection. Know where you go to get an injection given. Stay safe.